Multiplanar assessment, or functional assessment, is a method of identifying where muscular and movement imbalances may occur. When performing assessment, observe for areas of asymmetry, short structures, and weak muscles. By performing this simple assessment, the massage therapist can begin to target areas for massage application. The client has a tendency to rotate, which would be in the transverse plane, while moving in the frontal plane, performing the lateral bend. Movement also occurs in the transverse plane using rotational movements. During the squat assessment for this client, the slight movement of the knees toward the middle indicates weak hip abductors. Balance mechanisms are assessed by having the client stand on one foot and then switch to the other foot. In our client, balance mechanisms are good since he can easily stand on one foot. When viewing the client from the side during sagittal plane movements, no obvious imbalances are identified. When viewing the client from the side as he moves in the frontal plane, the torsion pattern identified previously when viewing from the front is also identified. Transverse plane movement indicates no obvious dysfunction. Squat assessment indicates a short latissimus dorsi on the left. The following passive joint movement sequence provides examples of how joint movement and range of motion can be applied to the body during massage. Any one of the positions demonstrated can be a beginning point for either a stretching procedure or a muscle energy procedure. The various positions can also be beginning points for muscle testing assessment. When performing joint movement, the range of motion of the joint areas is assessed. Areas of ease and bind in the soft tissues can be identified, and the types of joint end feel are also assessed. Range of motion activities can be performed in all basic massage positions: prone, side lying, supine, and seated. During the massage, the methods are incorporated as it is convenient. Any of the passive movements demonstrated can also be active movements if the client performs them themselves. The joint movements follow the multiplanar activities of flexion, extension, abduction, adduction, and rotation. Adductions and abductions are movements in the frontal plane. Flexion and extension movements are in the sagittal plane. Rotations, internal or external, also called medial and lateral, occur in the transverse plane. Joint movement should always be smooth and rhythmic. The area during the movement procedure is taken in and out of bind, always within the physiological restriction barriers. Joint movements are never forced. Adding small oscillation movements during range of motion has an effect on the proprioceptive mechanisms of the joint. The typical response is that the muscle will relax. Rhythmic joint movement is an important part of lymphatic drain procedures. During joint movement activities, it is important to make sure that the area is stabilized appropriately, so only the joint being targeted moves. Again, any joint movement can become a muscle energy method, stretching method, or muscle testing method simply by either taking the tissue past bind for a stretch or having the client hold against resistance for any muscle energy technique or muscle test.